perform eye drop administration, and these are the procedure. First is always confirm your patient's identity prior to giving any medication by verifying name and date of birth. Second is obtain the correct medication and double check that the correct drop is in your hand by reading the label. Pay strict attention to the expiration date. Third is perform good hand hygiene with soap and water or an alcohol-based hand sanitizer. 4. Inspect the medication of cloudiness, discoloration, and precipitation. The drop may not have expired, but there may be oxidation near the dropper. 5. Is explain the procedure to the patient, being sure to explain possible side effects of the medication. 6. Is have the patient assume a sitting position or lay in a supine position. 7. Is instruct the patient to tilt his or her head back and look up with eyes open. This position of gaze provides maximum exposure to the lower fornix and moves the cornea away from the lower lid, minimizing the risk of the contacting the eye, lid, or lashes with the tip of the bottle or tube. 8. Using your non-dominant hand, pull down gently on the skin over the cheekbone to expose cul-de-sac of the lower lid, creating a cup in which to catch the medication. Next, when administering ointment, hold the tip of the tube close to the eye and with a light, even pressure, squeeze out a thin ribbon from the inner canthus to the outer canthus. Next, to prevent contamination of the medication, be careful not to touch the lid, lashes, or eye surface with the dropper or tip of the ointment. Next, ask the patient to blink a few times to distribute the medication and then gently close the eye to allow for absorption. Next, gently wipe away excess medication or tears with a tissue. Remember to use a clean tissue for each eye to prevent cross-contamination. Next, replace the cap of the bottle or tube to prevent contamination and return it to the storage area as recommended by the manufacturer. Next, if administering more than one medication, it is optimal to wait 3 to 5 minutes between each to allow for adequate absorption. 16. Perform post-procedure and hand hygiene. And lastly, document medication administration in the patient's medical record to include the eye or eyes treated and date, time, and dose. Be sure to note any adverse reaction and the patient's response. Today, ma'am, I will be putting eye drops in your eyes. Kindly look up straight. Bisa bisa. Salang. Yung. Okay na? Okay na. Sige, so, kuhaan hapon. Pwede po. Bilis lang. Wait, okay na? Thank you. Welcome.